In today's session, we're going to talk about a fascinating article that highlights how our government is ignoring the strong connection between diet-related diseases and increased vulnerability to poor outcomes with COVID-19. Now, this is a fascinating article. I was surprised to actually read this in the media site Politico.com, which historically is very left-leaning. They shared a lot of scary statistics about COVID and all this sort of stuff. Now, there's about 10 or 15 paragraphs that I would like to read to you. And we're going to talk more about some of these and related books and articles. Diet-related diseases pose a major risk for COVID-19, but the U.S. overlooks them. We're going to talk about how much money we spend from Medicare and Medicaid on managing diet-related diseases like obesity, like diabetes and heart disease. Now, again, the paradox here is we've been hearing from all of our local, our senators, our governor, our president, about how we need to do everything. It's our moral obligation to do all these things to save lives. Yet at the same time, they are subsidizing. They're in bed with the big food companies that are making junk food cheaper, that are making people more vulnerable to all sorts of diseases, including the disease that they want you to protect others from. So this article, again, from Politico, is exposing that. And it's crazy because this is a big double standard and hypocrisy. So let's break it down. As the pandemic heads into its third year, the connection to diet-related diseases and the overall vulnerability of the American population is a theme that remains absent at the highest levels of government. Shocker. I know since you're watching this video or listening in iTunes, you have probably shared proactive health information with your friends and family. Like, hey, maybe you should walk more. Maybe you should lift weights. Maybe you shouldn't be ordering takeout that has phthalates and persistent organic pollutants that have recently been discovered to cause cancer and contribute to all sorts of diseases. Like, you shouldn't be doing that, but they call you a conspiracy theorist because guess what? The legacy media up until this very article, for the most part, haven't talked about the connection between the diet-related diseases and poor lifestyle choices as a major risk factor for increased disease severity. We've only heard about washing our hands 10,000 times a day. We've heard about double and triple masking. We've heard about vaccines. That's pretty much it. So I think this is important because once the legacy media start to talk about things, it becomes sort of the gold standard. It becomes common knowledge. But up until that point, it's all a conspiracy theory. Like the pendulum is always swinging, right? So we can make these observations. We can share the academic literature. The connection between obesity and poor outcomes and high prevalence of chronic diseases as a risk factor for more severe COVID has been known since April 2020. We've talked about these articles here on this very channel and on my Instagram since April 2020, actually before that. March was when we first started talking about this. No one wanted to listen. The comments that I've read over the last 18 months, and I know you've had these comments directed at you, the hate, the vitriol, the sort of accusations that you want people to die by sharing proactive health information. Like that's the conclusion. That's this false dichotomy. If you suggest that people become healthy, you want people to die. That's what literally the irrational people think. It's insane. So here we have a great resource now to send to those friends and family and say, hey, you know what? There is a connection. And guess what? The government, the people that you voted for, are completely ignoring that. As the article goes on to say, the only high-level Biden administration official who routinely talks about these complex issues between big food and agriculture and government subsidies is the current Agriculture Secretary, Tom Vilsack, as he brings this up often. So hopefully there is hope to address the rapid increase in obesity and chronic disease. So they introduced the article talking about how in April, when UK's Prime Minister Boris Johnson got really sick, and he made a push to help sort of curb obesity, and he admitted that he was really overweight. After his hospitalization, other countries like Chile and Mexico seemed to hop on board. You might remember that Mexico was having a warning label preventing big food companies from advertising to children. There were some new warnings put on soda pops and things like that. Scientists have estimated that nearly 2/3 of COVID-19 hospitalizations in the U.S. were related to obesity, diabetes, hypertension, and heart failure, all of which, by the way, are related to, guess what? Your diet and lifestyle, for the most part. Do genes play a role? Yes, but they're a super small role in relation to the relative importance of diet and exercise, sleep management, and so forth. One study found that patients with a body mass index of 45 or higher, that is severe obesity, were about a third more likely to be hospitalized and more than 60% more likely to die from the virus compared to individuals without those diseases. The pandemic and the resulting lockdowns have also worsened obesity rates for both adults and children, according to earlier data, and we've covered that data extensively. Unfortunately, the very people that got impacted the worst were kids between the ages of 5 and 11, which, by the way, friends, if you remember the announcement last Friday, the 29th of October, I did some media coverage of that on iTunes, so check that out. It's not here on YouTube, but if you want to learn a little bit more about that, check that out in iTunes. The pandemic and resulting lockdowns have also worsened obesity rates for both adults and children, according to data. Now, we've released that data. We've talked about that data from the CDC, from the New England Journal of Medicine, from the JAMA, so we're not going to dive into that there. But if you missed those episodes, the main finding from this was, unfortunately, people that were overweight became more overweight or even obese. People that were already obese became morbidly obese. Children, that those trends happened. So the people that were even vulnerable for gaining more weight, it just cranked up the thermostat. And that was really unfortunate to find that even children between the ages of 5 and 11 were the group that got the most disproportionately impacted by the rates of obesity and overweight increases. So there are a number of theories, they go on to say, about why, from less exercise and less sleep to poor nutrition, more snacking, and a whole lot more stress. So all of those factors. And honestly, I think just the fear-mongering from the media saying that if you go outside, we don't know how transmissible this is, your entire family might die, we know that outdoor transmission is essentially zero. So that was a big part of it. And then also encouraging takeout. We know that takeout, there's a recent report, I think it was Thursday of this last week, this is common knowledge, again, that the packaging of processed food containers and takeout containers and stuff like that has persistent organic pollutants and phthalates and endocrine disruptors that are problematic. So again, takeout is bad for the environment. It's not healthy. It's not fresh food normally. And then the packaging in and of itself has unintended harms that worsen the very condition that we're trying to stay safe from. So I didn't, engage in any takeout food for the last 20 months or almost my entire life. We never eat that sort of stuff, and neither should you. But the fact that our governors and politicians were promoting that instead of just letting people exercise their own caution and take risks by going to the restaurant itself, that never really made sense to me. So again, this article and the recent data on phthalates is confirming that. So it's funny how these things that were conspiracy theories are now becoming proven over time as the establishment media catches up to all the things that we've been saying. Now, here is the most ironic picture, and it sort of epitomizes all of the poor decisions that we made over the course of the pandemic. So this is great that it's coming right from Politico. It's not like Wall Street Journal or any right-leaning site. This is from a very left-leaning news site. It's a student, if you're listening to this in iTunes, eating lunch separated from other classmates by a plastic divider. Remember how many lives were saved from these very important plastic divider? However, he's eating junk food. And you can see in these images, the snack items from the vending machines that our kids are eating from and the food that is being served to these kids are prepackaged junk. It's highly processed stuff. So we have plastic dividers everywhere because they're so important, these plastic dividers, yet we're feeding our children hyper-palatable, ultra-processed junk food wrapped in plastic. You're like, oh my gosh, are you kidding me, right? Like we did all this? Anyway, you know how I feel about that. I'm sure you feel the same way. It's not central to the discussion at all, meaning that we're not talking about the diet-related increases in obesity as a risk factor for severe COVID, said Dan Glickman, who served as the Agriculture Secretary during the Clinton administration and is now a senior fellow at the Bipartisan Policy Center. Glickman noted that the country's leading voices on coronavirus, including the most trusted doctor in all of the land, Dr. Anthony Fauci, don't focus on underlying conditions and what could be done about them long term. Instead, they focus solely on immunizations. Okay, we've all been critical of that. If you want to take your shot, that's fine. But can't we also talk about other things that make people less vulnerable? No. Those conversations get relegated into the conspiracy theory junk box. And if you say those things, if you want people to get healthy, you're judgmental, you're racist, you're a white supremacist, and you don't understand equity. That's literally where the conversation up to now has gone. It's been really challenging to talk with people about this. Glickman goes on to say they hardly ever talk about prevention. It's missing. It's a gigantic gap in the discussion about how health care relates to COVID and how it might relate to the prevention of disease. Again, I don't want to sound like a broken drum. We've been talking about this for such a long time and it's been so frustrating. So they talk about how doctors don't even understand obesity, and that's important. And if we think about the obesity rates in healthcare practitioners and providers and associated staff and nurses, they are at the same prevalence as the general population or sometimes even higher. Now, some people say, well, yeah, that's because the profession is stressful. Okay, well, let's relook at the healthcare profession. We shouldn't be making people sick while they're helping other sick people. That doesn't make any sense, right? But also we need to look at the education that doctors are receiving and better help them understand that, well, yeah, medications have their place. Western allopathic medicines, surgical procedures have their role, but we also need to include diet, nutrition, lifestyle, stress management, sleep, strategies. We don't talk about that. When you go to the hospital, the food that you're served is oftentimes hyperpalatable junk, right? That is part of the problem. So as Glickman says, these conversations should be central to the discussion, but unfortunately they're not. So before we continue on, friends, I just want to welcome you back. It's Mike Muscle. Thank you as always for being here. Just want to give a shout out to my friend for sending me this shirt, Mandate Fitness. I make no money off this, but I will link their Instagram and where you can get more shirts like this on our sister company website, Myoscience. We have swag and shirts that can help you spread the message that we should be promoting healthy living and nutrition and lifestyle, because healthy living and exercise saves lives as well. So I'll put links to that below, but let's continue on. And if you're enjoying this content, you can hit that like button. Be sure to subscribe and leave a comment. That goes a long way. That helps other people like you who are interested in understanding what we can do to help people become more healthy, get this message so we can all, have better conversations, because clearly, and I don't want to use this word, in tongue in cheek, but we have a big problem. And we need a lot more people to acknowledge it and to address it and to do something about it. So we can't just continue to rely upon these politicians to do something about it, because clearly there's conflict of interest and they're in bed with big food companies. Going on, diet-related diseases hasn't been top of mind for Congress either. No kidding. You mean the Congress people that put on their face masks while they take a photo, then take them off right away in closed quarters? You mean they're not talking about nutrition? They're not trying to pass bipartisan bills? Shocking, right? I know that's really surprising to you. Now, they say that the problem is deeply entrenched and on a staggering scale. More than 42% of American adults, about 100 million people, had obesity before the pandemic began. And according to the CDC, nearly 3/4 of American adults are overweight or have obesity now. Roughly 1 in 5 children now have obesity. The costs associated with this epidemic, along with diabetes, hypertension, cardiovascular disease, and cancers, all related to diet, by the way, we need to remind our friends that diet matters, are among the greatest threats to the fiscal future of the United States, not to mention health, well-being, and productivity of millions of people. Not to mention, by the way, the article doesn't talk about this, but this is just me going off the cuff, that obesity rates, as we just talked about, have increased. If you ask your friends who are hospitalists, who work in the ICU or the ER, they are slammed. If they're on call, cardiologists, they are so slammed. People are more unhealthy now than they've ever been. Look at the census data. You don't have to trust me. Go Google hospital census data. The ICUs and the ERs are just jam-packed. There was an article in the NPR last week saying that, hey, our ERs are overflowing, but it's not with COVID patients. It's with people that have heart disease. They have all these chronic issues. Maybe they were scared to go to the hospital before, or I think there's data to support this, they're weaker now. Their immune systems, their metabolic health, their cardiovascular health, they're more obese and more sick than ever before. In Washington, there's been no such wake-up call. This is referring back to, in Chile and Mexico and the UK, there was a wake-up call. There was different politicians trying to steer the conversation to focus more on diet-related issues and the links to COVID susceptibility, but there's been no wake-up call here in Washington. Again, this is Politico saying this. They are not a right-leaning by any stretch of the imagination. They are being critical of various administrations and politicians. So there is no such national strategy. There was no system-wide approach, even as researchers increasingly recognize that obesity is a disease that is driven not only by lack of willpower, but by a modern society and food system that's almost perfectly designed to encourage the overeating of empty calories, along with more stress, less sleep, and daily exercise, setting millions on a path to poor health outcomes that is extremely difficult to break from. Man, that is really powerful right there. Like I said, this is a great article. There's this author here. I want to get her on the podcast. Her name is Marion Nestle. She's written a lot about this. She's the author of the book, What to Eat. It's a great book. Definitely check it out. It was published, I think, 2 years ago. She says, nobody is doing anything about this. Nobody is saying all this has to stop. She says, and how do we stop it? With great difficulty and political will. So we do need politicians to get involved, because ultimately they are subsidizing, like through the Farm Bill and various bills, they are subsidizing the commodity crops that artificially make hyperpalatable junk food cheaper, which then creates people who are trying to save money. It's ironic that people at the bottom eat the worst of the worst food that is subsidized by the government. Like it's this vicious cycle that needs to stop with politicians. Now, why do governments fail? This is a really great article in the Plus One journal. She says, a more uncomfortable reason is that it requires tackling vested interests, especially the powerful big food companies with strong ties and influence over national governments. This is a difficult terrain for many public health scientists. It took 5 decades after the initial studies linking tobacco and cancer for effective public health policies to be put in place with enormous cost to human health. Must we wait 5 decades to respond to the similar effects of big food, especially as it relates to this current virus that is endemic that's not going away? Now, I think that article is a good one in Plus One Biology. Check that out if you're interested in understanding food policy and what to do and how we can respond and associated references. But going back to Politico, they say there's a deep-seated belief in America that obesity and diet-related diseases are the result of personal choices, and anything the government does to meddle with our diet is an assault on American liberty. I don't know that I totally agree with that. I think the government should get out of the food entirely, right? They shouldn't be subsidizing that. Make the playing field level. You shouldn't be able to get a Happy Meal for cheaper than you can get an avocado. That is clear government subsidization of those foods, and that artificially inflates the cost of real food, and that's not good. So the narrative is increasingly being challenged by science. Research shows that once someone is obese, that there's almost no dietary or exercise interventions that are successful at reversing the disease over the long haul, and many people lack access to more aggressive treatments like drugs or bariatric surgery, so I definitely don't agree with that. Yeah, there is recidivism, and that's why I was so critical of closing schools, of keeping kids home, of closing gyms, because the people that needed to be fit are now more overweight, and getting that weight off is hard. Like, there's no question, but you can lose the weight. Hundreds and many thousands of people do. But of course, it's hard in this environment, especially if you just count calories and you try to have exercise willpower to not eat the hyperpalatable junk food. So that becomes a challenge. So in the final paragraph here, in an interview with Politico, Tom Vilsack noted that more than half of the $380 billion per year spent treating just cardiovascular disease, cancer, and diabetes is now picked up by the government, including through programs like Medicare and Medicaid. So you should be irritated. Much of your tax dollars is going back in to treating diseases that are actually caused by the government subsidizing the junk food, and their health is suffering unnecessarily as a result of that. So we need more accountability. You should go to look and who has been voting yes on the Farm Bill. The Farm Bill is one of the bills that subsidizes the commodity crops that make the wheat, corn, soy, canola, and all of that sugar cheaper than it really needs to be. I will tell you that one of the people leading the country has repeatedly voted yes on that Farm Bill. We need more accountability from the people who say that they care about saving lives, but yet on the one hand are participating in the destruction of quality adjusted life years, by making these things cheaper, right? So again, all we're asking for is level the playing field. I think that should be the goal going forward. And to not censor scientists for bringing this sort of stuff up, and to sort of get the political action committees out of government interference so that we can, again, get big food sort of away and out of the back pockets of the politicians and policymakers. So that's what I have for you today, friends. Hopefully you got some value out of this. We'll link the article here. And again, it's good to start to see this conversation happening from the establishment media, because up to now, honestly, we've only been told about washing the hands, double and triple masking, and vaccines, and staying in our house. We have not been most people, the only way they got this information was from following so-called conspiracy theorists that were promoting exercise, that were promoting intermittent fasting, vitamin D, and things like that, right? Which, unfortunately, those people, like myself, have been facing censorship and throttling back of the organic reach of our content because the establishment media hasn't yet sort of endorsed it. So hopefully, Washington Post and New York Times and maybe CNN and these other networks will see this article in Politico and start to get the ball rolling. And if we can get the people that were so enthusiastic about saving lives during the COVID outbreak, maybe they can get equally enthusiastic about saving lives from chronic disease, right? That, of course, takes a different mindset where you want to encourage people to exercise, and you actually have to go out and be proactive instead of passive in terms of how you prevent those diseases. But let's face it, being healthy needs proactivity. You have to be proactive. You have to be a participant. You can't just sit there, slap a mask on and sanitizer, and stay in your house and watch CNN. You have to do more. You have to get out and exercise. You have to compress your feeding window. You have to eat real food. You have to cook your food from scratch, not just order it on your phone or tell Siri to order food for you, right? You have to do more. And if you don't invest in your health, then who's going to do it for you? No one. No one's going to come save you, friends. You and you only are responsible for your life, for the trajectory of your life, for your health, for your happiness, for your mental well-being. You and you alone. So please encourage your friends and family to take accountability, to do the things and start by sharing this article. Check out the books by Marion Nestle, What to Eat, and understand some different, aspects there about the importance of eating real food and cooking it from scratch and all of that. So as always, I'm grateful that you tuned in all the way. Hopefully you found this podcast helpful. If you did, you can leave us some feedback in iTunes. That goes a long way. You can subscribe to the channel. You can leave us a comment. That really, really helps us out. That helps the algorithms, which unfortunately are throttling back health channels for sharing content just like this, which is not good. So as always, have a great rest of your day, and we will catch you on a future podcast down the road. Bye now.